Greetings to all listeners. My name is Natella Sukhanova. I'm the head of the Aniridia Center. At the beginning, I would like to thank the organizers for the invitation and opportunity to tell you about the Russian Center for Aniridia and WAGR syndrome. My report has an introductory purpose with a short presentation of each department and what opportunities patients have when they come to our center. The Research Institute of Pediatrics and Children's Healthcare of the Central Clinical Hospital of the Russian Academy of Sciences performs research and real-world patient management with the goal to tackle urgent problems of preventive pediatric medicine and to implement medical breakthroughs into public healthcare practice. Leila Namazova-Baranova, professor, academician of the Russian Academy of Sciences, is the head of the Research Institute of Pediatrics and Children's Health. Our center has a modern and comprehensive hospital infrastructure designed for maximum care. We offer a full range of clinical ophthalmologic services, including consultation of magnifying visual devices and modern diagnostic equipment. We diagnose, treat, and provide follow-up for diseases of the cornea, glaucoma, and diseases of the retinal and macula. Multidisciplinary approach ensures the prompt diagnosis, treatment, and rehabilitation of various diseases in children and adolescents from 0 to 18 years of age. Highly qualified and experienced pediatricians and doctors of other specialties provide children with highly qualified help. The clinic is equipped with advanced diagnostics and laboratory equipment that allows you to quickly and accurately diagnose various diseases in children. In order to implement the continuity of the transfer of knowledge and practical skills in the field of Russian experience in the diagnosis and treatment of aniridia, a team of experts has been formed as a part of the center to develop and disseminate information among doctors and patients regarding the methods of diagnosis and treatment of this rare disease. Considering the problems associated with WAGR syndrome, we offer each patient multidisciplinary treatment options and a personal approach. Auditory and sensory processing disorders, behavioral and psychiatric disorders, chronic kidney disease, head, ears, nose, and throat abnormalities, metabolic and endocrine abnormalities, neurological abnormalities, and sleep disorders. 18 patients with WAGR syndrome are currently observed in our center. Let me introduce you a unique department when patients from all over Russia come to get medical advice from highly qualified specialists. And the head of this department is Natella Shakmadze, Doctor of Medical Sciences, leading researcher. This department deals with the problems of diagnosis, treatment, and prevention in patients with rare hereditary diseases. It develops clinical guidelines for physicians of various specialties and programs for the screening of patients with hereditary pathologies. Department of Developmental Neuroscience. Head of department is Georgi Karkashadze, MD, leading researcher, neurologist. As we know, sensory processing disorder is a condition in which the brain has trouble receiving and responding to information that comes in through the senses: vision, hearing, touch, taste, smell, balance, and position of the body. In the department, patients are given the following examinations in order to know your child's symptoms that helps you find ways to help him. It should be noted that while autistic-like behavior is common in people with WAGR syndrome, most do not meet the criteria for a diagnosis of autism. In addition, 90% of people with WAGR syndrome have some degree in auditory processing disorder, as well as other conditions that may impact their behavior. Careful evaluation is necessary to ensure accurate diagnosis and appropriate interventions. Each participant included in the study is examined using the following methods that you can see in this slide. Department of Innovative Diagnostic Research Methods is the main activity of this department is the development and implementation of modern research methods in radiation diagnostics, as well as functional and endoscopic methods of diagnosis and treatment. Every patient with diagnosis of WAGR syndrome must made abdominal ultrasound every 3 months until age of 8. After age 8, ultrasounds may continue at less frequent intervals, along with periodic abdominal palpations and assessment for hypertension and hematuria. In our center, all patients undergo obligatory ultrasonic diagnostics. All patients with WAGR syndrome can make immunization in the Department of Scientific Approaches to Immunizations of patients with disabilities and chronic diseases. More than 80% of individuals with WAGR syndrome have auditory processing disorder, APD. APD affects the way the brain receives, organizes, and processes sound. Children and adults with APD usually have normal hearing, but they can't process the information they hear in the same way as others do. Early diagnosis and treatment of APD can make a big difference in a child's behavior and ability to communicate and learn. In the Department of Audiology, every patient can make this exam. According to indications, patients with WAGR syndrome can be referred to the Department of Allergology too. Our center closely works with Federal State Budgetary Institution, Helmholtz National Medical Research Center for Eye Disease, and with Federal State Budgetary Scientific Institution Research Center of Medical Genetics. Thank you for your attention.